All right, let's talk about breast lift. Who needs a breast lift and how do we do a breast lift? So a breast lift is needed whenever the breast is droopy, whenever the nipple is malpositioned, not necessarily congenitally, but rather like with time, everything droops. Gravity has its effects, and the weight of the breast will pull everything down. So the nipple might drop below what we call the inframammary fold, which is the fold underneath your breast, or you might have breast tissue that kind of droops below that area. So in that case, the solution for that issue is usually a breast lift. There are different ways of doing a breast lift. So things that you can see on the outside and things that you can't see on the outside, but we do on the inside. So things such as where the incisions lie and how big the incisions are. So you can have what we call a circumareolar breast lift, where we just do kind of like a donut. We excise a donut-shaped skin around the areola and just tighten things together, and that's essentially mostly a skin excision only breast lift. It usually only works if you only need to move the nipple just around like 2 centimeters and there's not a whole lot of droopiness, and just to tighten things up a little bit. The other types of breast lifts include the lollipop or the vertical breast lift, where essentially you have an incision around your areola and then it goes straight down, just a vertical incision. It's good for people with moderate sized breasts and not a whole lot of droopiness, and that can control kind of the width of the breast and kind of tighten things up a little bit. The other type is the anchor incision, where it goes around your areola, straight down, and then at the breast fold. This incision gives us the most freedom in terms of how we control things, because it can help us remove the most skin, especially if someone has a really wide breast or a lot of droopy skin. So that would give us the ability to, first of all, move the nipple a good distance and excise the most skin. So the majority of patients who end up having a breast lift will end up having the anchor incision, though some people are candidates for the other types of breast lifts, which during your consult we can discuss. The other part that you wouldn't see on the outside is where the blood supply for the nipple is maintained. So there are different what we call pedicles or blood supplies that we maintain to the nipple itself. So the blood supply can come from the superior part of the breast, or it can come from the medial part of the breast, or superior medial or inferior part. That all depends on how much breast tissue we're going to remove, or how to kind of narrow down the breast to shape it better, or how much movement do we need to have for the nipple itself. So if you need to move the nipple a whole lot of distance, then you might opt for something more like an inferior pedicle, or having the blood supply come from the bottom, which has a kind of a wider base and gives it a bit more robust blood supply. Each one has its own benefits and its own kind of potential complications. So we're always happy to discuss that with you during your consult. If someone has both loss of volume and a droopy breast at the same time, then they might want to consider what we call an augmentation mastopexy. So essentially, we place an implant at the same time or at a later date from your breast lift. So what determines when we do both procedures together, or if we do them separately, will depend on your needs. And if we have to kind of move the nipple a long distance or do a drastic change with the lift, then we might want to delay the augmentation part and do it later down the line, like 6 months or so from your initial breast lift surgery. But if we're going to move the nipple a moderate amount and it's still reasonable to place an implant under the same setting, then we might opt for what we call an augmentation mastopexy. That will give you more fullness, it will make the breast more perky, and the lift itself, or the mastopexy part of it, will position the nipple in the right position and tighten the skin envelope around that implant. And usually that will give you the optimal result when it comes to people with loss of volume and droopiness of the breast. For a more bespoke plan to your needs, and if you have any other questions that you want answered or with regards to the topic, I'm happy to answer those for you during our consultation.